Ever wondered what an ACL injury is and how it can affect you? Well, let's delve into that. An ACL injury refers to an injury to the anterior cruciate ligament, which is a vital ligament that contributes significantly to the stability of your knee joint. It's particularly common among athletes, but it can happen to anyone. Imagine the knee as a complex system of levers and pulleys. The ligaments are like strong ropes holding everything together. The ACL is one of these essential ropes, and a tear or sprain can destabilize the entire system, leading to discomfort and a significant impairment of movement. Just like a well-oiled machine, every part of your knee has a role to play, and the ACL is no different. It's the silent hero, working tirelessly behind the scenes to keep your knee stable and your movements smooth. But when it's injured, its absence is keenly felt. Now that we understand what an ACL injury is, you might be wondering, how does one get an ACL injury? So, what can cause an ACL injury? Well, the anterior cruciate ligament, or ACL, can often be injured during activities that involve abrupt stops or sudden changes in direction. Imagine a basketball player swiftly pivoting to evade an opponent, or a soccer player abruptly changing direction to kick the ball. These sudden movements can strain and potentially tear the ACL. Another common cause of ACL injuries is incorrect jumping and landing. Picture a volleyball player leaping to spike the ball, then landing awkwardly. This can put extreme pressure on the ligament, leading to an injury. Lastly, direct collisions or falls, like a football tackle or a slip on the ice, can also lead to ACL injuries. The impact from these incidents can forcefully twist the knee and damage the ACL. While these injuries are common in sports, remember, anyone can suffer from an ACL injury, not just athletes. ACL injuries can be quite severe, but knowing the causes can help in prevention. Now let's delve into the symptoms and how to recognize an ACL injury. How do you know if you've injured your ACL? Well, there might be several telltale signs. One of the most common symptoms is a distinct pop sound or feeling in the knee at the moment of injury. This is often followed by severe pain that prevents you from continuing the activity. In the hours following the injury, you may notice swelling in your knee. This is your body's natural response to injury, as it tries to protect the affected area. Another key sign to look out for is a loss of range of motion. You might find it difficult to fully extend or flex your knee. And then there's instability, which could make walking feel like a daunting task. You may feel as though your knee is giving way when you try to put weight on it. If you notice any of these symptoms, it is essential to seek medical attention immediately. But what does the treatment process look like? How do we treat an ACL injury? Well, the answer depends on a few factors, such as the severity of the injury and the individual's lifestyle. For milder cases, non-surgical treatments are often the first line of defense. This could involve the RICE method, which stands for rest, ice, compression, and elevation. This approach aims at reducing swelling and pain and promoting healing. In addition to this, physical therapy is another key component in the treatment plan. It helps to restore function and strength to the knee, improving mobility and reducing the risk of future injuries. However, if the injury is severe, or if the individual leads a highly active lifestyle, surgery may be necessary. This often involves reconstructing the ACL using a graft, followed by an extensive rehabilitation process to regain strength and function in the knee. Remember, early detection and proper treatment can help ensure a speedy recovery from an ACL injury. Stay safe and take care of your knees.